So I always put this up there. This is me. I belong to a lot of different affiliations regarding cannabis, which is important to know because you should know that your provider is always linked with some type of organization that specializes in cannabis so that you're getting the most updated research and studies and reviews that are out there so that you're getting the best quality care. So I belong to organizations like the American Academy of Cannabinoid Medicine, the Society of Cannabis Clinicians, and the American Medical Marijuana Physicians Association. And then I also belong to some organizations through the nurse practitioner organization also. So I've been practicing in healthcare for over 25 years. I actually started out as a nursing assistant at Sisters Hospital back in 1990. Come on in. Hi Paula, come on in. I just started, I'm just talking about me.
Wow, this is where Paula belongs. Hello, ladies. Sorry to be
Hi,
late.
how are you?
I locked my husband out of the house and we had to go back.
Oh, yes, so I started in healthcare, well, actually, it was 1989, I worked as an aide at ECMC. And from there, I switched over to Sisters and worked there as a nursing assistant until I was accepted into Sisters School of Nursing. And that was in the early 90s. Went there for a few years and received my associate degree. And then decided after I had completed that I was going to go on for my bachelor's degree. And I did that at Damon College and graduated in 1996. At the time, I was interested in going on to be a nurse practitioner, but I wasn't interested in going to a big school like UB. So Damon was in the process of trying to develop a nurse practitioner program. So I actually was in the first graduating class of Damon College, and I graduated in December of 1998. So I've been practicing as a nurse practitioner since 1998. In April of 2017, I was practicing, specializing a lot in geriatric medicine and doing a lot of palliative care work. A lot of hospice type work was what I was doing, and I ended up getting into a severe car accident. I was actually hit by a drunk driver. And at that point, I was out of work, and I realized that I wasn't going to be able to go back and take care of those geriatric patients in a nursing home. But I had an alternative background because I actually worked with another physician about 20 years ago, and I was with him for about 5 years, and that's how I learned a lot about homeopathy and different types of herbal products. And I was one of the nurses that ran the IV clinic where we were doing nutritional IVs and chelation therapy and oxidative. So I had this background behind me, and I thought, okay, I need to head in another direction because I was thrown into traditional medicine through having to go through this process through the no-fault insurance company, and it was not a pleasant experience. And it isn't for anyone that you talk to that gets put in that type of position where they have some type of injury. And I was going to the neurologist, and I was receiving injections, and I was going for therapy, and I wasn't getting any better. And after 3 months of trying to do what they wanted me to do, plus they had put me on prescription medications, they wanted me to be on opioids, which I maybe took 3 of them and didn't respond well to them. They had me on different types of nerve agents for like peripheral neuropathy. They had me on different medications like Endocannabinoid and Lyrica, which were not working and just giving me side effects. And I thought, okay, I have this background. I need to figure out what I'm going to do. So I started to research cannabis. And at first, I was not familiar with a lot of what was out there because it's considered a Schedule I narcotic according to the federal government, which means that it's illegal. You can't study it in the United States. So there's hardly any research that's been done in the United States regarding cannabis. We had to look to other countries and see how they were using the herb and how they were using it medicinally to be able to help people. You figure at that point, in 2014 was when the Compassionate Care Act came into effect in New York State. So cannabis was something that was available, but I still didn't know enough about it. So it was offered to me at that point, and I said, well, you know, I want to try over-the-counter CBD. So I did some research about a company, and I found a CBD vape. And I thought, because I couldn't sleep at night, and I said, well, I'm going to try the vape and see what happens. So I did the vape for about 6-7 months, and I was able to go to sleep. And I was sleeping through the night. It wasn't perfect, but I wasn't waking up every time I rolled over in excruciating pain. And then I was, getting good results from it, and I said, you know what, there's other people out there that need to know about this, that there are alternatives out there to the traditional regimen of medicine. And in January of 2018 was when I opened Advanced Integrative Care, and I decided to do medical marijuana consultations and treatment. And so that's how the practice started, and that's what kind of brought me in this direction. And I'm very excited to talk about cannabis because there are so many people that do so well on it for so many different conditions. So that's one of the things I'm going to talk about today during the presentation is why does it work for so many different things? Okay? All right. So this is just an outline. We're going to start with the origin of cannabis. We're going to talk about the endocannabinoid system, which has CB1 and CB2 receptors. I'll explain to you what those are. Medical cannabis, we're going to talk about side effects, drug interactions, people who can't take it, how to dose it, and THC and CBD, which are the two endocannabinoids that we actually can extract from the plant to be able to use to treat patient's symptoms. And then I'm going to talk to you all about the New York State Medical Cannabis Program and how you can become certified. So we need to start at the beginning because there's so many interchangeable words when you're talking about cannabis. So I want everybody to be on the same page as where we're starting. So cannabis is Latin, and it's the plant's genus name used most often by botanists and pharmaceutical companies. And it comes from the Greek, which is cannabis spelled with a K, and it means hemp. Medical cannabis, medical marijuana, are whole, unprocessed cannabis plants or its basic extracts that treat symptoms of illness and other conditions. Marijuana usually refers to the leaves of the female flowers of the cannabis plant. There's also things out there called terpenes, and terpenes are the essential oils of the plant, and they produce the flower or the fragrance. So depending on what type of cannabis is being grown, they're all going to have a different aroma associated with them. So you might smell one that's more fruity, and then you might smell one that's more earthy, and then you might have another one that's more of a citrus type one. But the gamut is from mild to wild. Hemp has been in the news a lot because there's a lot of hemp that's being grown now. And I always get questions about, well, what's the difference between cannabis and what's the difference between hemp? And hemp is actually the fiber of the cannabis plant, and it's extracted from the stem. So when you think about hemp, think about rope, fabric, fiberboard, paper, all those things are for hemp. So it's more industrial versus internal use. But hemp does have some internal value also, because it's very rich in protein and fiber. It's high in omega-3 and omega-6 fatty acids, which means it's going to help with cardiovascular disease. It's really rich in arginine, which is one of your 9 essential amino acids. So again, it's going to benefit the cardiovascular system. So this is just some pictures of some hemp seeds. And people can incorporate hemp seeds into just about anything. You can grind them up, put them in a salad. You can put them over yogurt, lots of different ways. So cannabis has different plant types. And we talk about them as indica, hybrid, or sativa. So indica provides a more sedating and full body calming effect. So indica would be something that we would want to use at night to help you get to sleep and stay asleep. A hybrid is going to be a combination of both indica and sativa. And this is going to depend on how the actual parent plants were crossbreeded. So a lot of times when you have a hybrid, you're still going to get some of that sedating effect, but not to the point where it's going to put you to sleep, because it's combined with sativa. And sativa actually helps with energy and mental clarity. So that's something that can be used during the day. And people don't feel like they can't use it at work because it doesn't give them the calming sedating effect. It actually helps to uplift them. Cannabinoids. Cannabidiol is one of the classes of a diverse chemical compound that acts on what's called cannabinoid receptors. And what it does is the cells alternate the neurotransmitters released in the brain. So when we think about cannabinoids, this is what's going to actually affect a lot of our neurological system and our brain function. There's at least 113 different cannabinoid isolates that we can pull from the plant. The most common, and these are the ones we talk about, and these are the ones that we're looking at is in New York State, is THC, which is tetrahydrocannabidiol, and CBD, which is cannabidiol. The endocannabinoids, the 113 endocannabinoids, are produced naturally in the body of animals. There's also phytocannabinoids, which are the ones that are found in cannabis and other plants. And then there's also synthetic cannabinoids, which are manufactured artificially. The most common one out there is Marinol. And Marinol has been on the market for many years, and it was used a lot for patients that were failure to thrive because they were having what's called wasting syndrome. They would take in food and nutrients, but they weren't able to process, so they were gaining weight, they were losing weight. They use it a lot for cancer patients because they would have nausea and vomiting, and they were having difficulty with appetite stimulation. So Marinol was used for that. When I look at that, and I look at now of what we have cannabis available to us in its purest form, which is in the plant-based form, why would you ever want to use something manufactured to pretend like it's cannabis? Just use cannabis. So now I'm going to get into a little bit about the history, which is the origin. And this can get a little dry. Okay. So, and the only reason I put this in the presentation is because I think it's important to know how long cannabis has actually been used in other countries. And usually it's been just used as a regular herb, and it still is used that way. It's just in our country that things have been kind of messed up for a while. So going back to 2737 BC, Shenyang was a Chinese empire, and he started to prescribe cannabis tea for the treatment of gout, rheumatism, malaria, and patients with poor memory. It was in the late 18th century. There were early editions of the American Medical Journal that actually recommended hemp seeds and roots for the treatment of inflamed skin, incontinence, and venereal disease. And then it was Dr. William O'Shaughnessy who popularized cannabis medical use in England and also in the Americas. And he found that marijuana would actually ease the pain of rheumatism. He would be used in patients that had difficulty with nausea and in cases of rabies, cholera, and tetanus. So this was all before we had vaccines available. At the end of the 19th century, American attitudes started to change significantly. And this was because 2 to 5% of the US population was unknowingly addicted to morphine. And if you think about when morphine was being used at that time, a lot of it was in like your cough medicines. It was part of a remedy that was in a cough medicine that was being given to a lot of people on a regular basis. So in 1906, the government introduced the Pure Food and Drug Act. And what this did was it put opium under the control of the physician. So now somebody couldn't just go to their local pharmacy and pick it up in a cough medicine. Now they had to go to their doctor and get a prescription to be able to take it. At that time, marijuana was not part of that. So people were still able to get marijuana or cannabis legally on their own. And it was in 1935 that 23 states had outlawed cannabis. And this goes back to the Mexican Revolution in 1910. What was happening was people were starting to immigrate from Mexico into the United States, and they were bringing their marijuana with them. And especially in the southern states, there was a huge stigma attached with marijuana because they thought that there was some type of, it's not the word I want, like sadistic thing associated with cannabis. They thought that it was like Satan's drug. It was in 1937 that Harry Anslinger became the director of the Federal Bureau of Narcotics, and he held that position from 1930 to 1962. And he was instrumental on playing on the fears in order to get the government to pass the Marijuana Tax Act, which made marijuana illegal. As immigrants started to move along the different ports of the Gulf of Mexico, including New Orleans, the media began to associate cannabis with the jazz musicians, blacks, and prostitutes. And this helped to fuel the hysteria that surrounded cannabis. So Anslinger actually used to keep files on these jazz musicians and their bandmates, such as Count Basie, Duke Ellington, and a bunch of others, and they felt that there was satanic music, their jazz and swing, was the result of marijuana use.
Wow.
Mhm. In 1950, Congress passed what's called the Boggs Act and the Narcotic Control Act, and this laid down mandatory sentencing for drug offenders, and this is when marijuana became part of that, and that's when it became illegal for possession and distribution. In the 1970s, there was some easing in the marijuana law, but then Reagan took administration and he started the Get Tough drug policy, which followed for decades, and it applied to marijuana as well. So today, cannabis is categorized as a Schedule I drug, and it's categorized to be one of the most dangerous drugs out there, along with heroin, LSD, ecstasy, and quaaludes.
Get out of here.
Yep. So according to the FDA, that's the schedule classification, which is why when you are certified for cannabis in a certain state, you cannot cross the state lines, because it's only
Really?
state regulated. It's not federally regulated.
Wow.
So it's something you can't take with you if you're going on a cruise. You're not gonna wanna take it with you when you're flying in an airplane, because the minute you
Really?
get off the ground, you're in federal airspace.
Wow, that's
Really?
interesting.
Okay? Because there haven't been a lot of studies, because of what's happened in our history, our political history, cannabis has still been listed to have no medicinal value. Regardless of the fact that they're in the American Medical Journals very early on, they were using cannabis for multiple chronic conditions. But right now, they say there's no medicinal value in cannabis. It's important to know that to this day, no one has died of cannabis use. People ask me that all the time. They don't die of cannabis use. If the cannabis is purchased illegally and it's been laced with something else, whether it be fentanyl or an opioid or heroin, though people are dying because of that, they're not dying because of pure cannabis. Okay? So it's important to understand what's going on in the body when we're feeding cannabis. And the endocannabinoid system is something fairly new. I can tell you that when I was in nurse practitioner school, and any doctor that had gone to school, we never learned about the endocannabinoid system at all, because according to the medical journals, it didn't exist. So I'm going to talk a little bit about when we started to actually realize that there's this whole other system in our body that's working that we never knew needed to be fed. So it was Professor Raphael McCollum, and he was an Israel organic chemist and a professor of the Hebrew University of Jerusalem, and he's considered to be the father of cannabis. And one of his quotes I thought was really good. He said, "By using a plant that's been around for thousands of years, we've discovered a new physiological system of immense importance. We wouldn't have been able to get there if we had not looked at this plant." So it was in 1990 when everything started to really happen from a medical perspective as to learning about the endocannabinoid system. So if you really think about that, that's not that long ago.
No.
Plant's been around for thousands of years, and we're just getting to the forefront in the 1990s. So it was Lisa Masuda who discovered what's called a CB1 receptor in a rat brain. So now we're going to be talking a little bit about the neural system. It was in 1993 that they found the second CBD2 receptor, and that was found in the immune system, the nervous system, and also in the gastrointestinal tract. So one of the qualifying conditions for New York State is IBS, Crohn's disease, IBS and Crohn's disease. And this would be one of the reasons why cannabis works for those disease processes, because we're feeding that CB2 receptor. Okay. I'm going to move on to the next slide. So this is kind of a busy slide, but I'm going to focus more on the right-hand side of the slide. So the function of the endocannabinoid system. It is found throughout the animal kingdom. Everything on our planet, with the exception of insects, has an endocannabinoid system. It maintains homeostasis, so that means it's going to maintain balance in your body. It's going to help to modulate your immune system and your inflammatory response. It's going to maintain a positive energy balance. And it can be used for almost all disease states. When we're using cannabis in the body, what we're trying to do is we're trying to manipulate these receptors throughout the endocannabinoid system to treat the symptoms or the disease that the patient has. Hi, come on in. So this talks about CB1 receptors, and what's important to know is where are they located? So they're distributed throughout the brain, and that will focus in on our pleasure, our memory, our thought, and our concentration. So if you think about things that we're dealing with in our everyday life and different types of stressors, and we think about Alzheimer's disease and difficulty with memory, things like that, brain fog, people complain of brain fog. This is what we're looking at when we're looking at CB1 receptors. So this is how cannabis is going to play into that. It's also found in a lot of the peripheral organs. So here we have the uterus, the liver, the pancreas, the musculoskeletal system, adipose tissue, which is fat tissue. So your CB1 receptors are going to help with intestinal motility. So again, we're getting back to the GI tract. It can help with people who have issues with fertility. It's going to have a protective component for the circulatory system and the cardiovascular system. It also helps with hormone balance in patients that have problems with obesity and metabolic rate. And then we have the CB2 receptors, which are primarily located in the immune cells and in the tissues. CB2 will modulate your inflammatory response, so it's going to help with any disease that's related with inflammation. CB2 are going to react in your smooth muscles, your urinary system, and your reproductive system. So when we think about patients that have muscle spasms or MS or ALS, we're looking at CB2 receptors. This slide gives a summary of what we're looking for as far as a desirable effect with cannabis and an undesirable effect. So what we want is we want people to have decreased pain, decreased nausea, and increased appetite. Those are all things that we're looking for. Those would be positive. If we have a diabetic patient and they have problems with insulin, and they have insulin resistance, what we're doing with cannabis is we're going to help to decrease the insulin resistance so that they're actually able to process the insulin. And a lot of times that's related to inflammation and also fat storage. So cannabis will help with that also, or it can help with that based on those receptors. Some undesirable effects is that we don't want patients to have any increased cardiovascular issues or increased inflammatory issues. And that's going to be a matter of figuring out what ratio of THC to CBD you need for that patient so that they don't take too much of it and go in the opposite direction and not be where you need them to be. Any questions so far? It's a lot of information, but I think it's important for you to kind of know really what you're taking. It's very easy to go smoke the plant and just say, okay, it works, but why does it work? Okay, so the next thing I'm going to do is get really into the cannabis. So we're going to talk about THC and CBD. So those are going to be our cannabinoids. Again, THC is tetrahydrocannabidiol, CBD is cannabidiol. THC is really good to reduce nausea, decrease pain, and help with appetite stimulation. It's going to bind to your CB1 receptors and help to modulate or increase and make those CB2 receptors work the way they're supposed to. THC is also usually associated to the euphoric effect that people get from recreational cannabis. What we're able to do at a medicinal level is we're able to microdose down the THC, that we can still get the benefit without the psychoactive component. So this is quite a conversation that I have with patients that are coming from a recreational standpoint who have been using it and they feel good when they're on it. And they go on to the medical and they're like, I don't get high on this. Like, why am I not getting high? You're not gonna get high. But if that's the effect you're looking for, this isn't what you're gonna get from here. But we're still gonna be able to treat your symptoms and be able to treat them more effectively.
Oh, that's good.
Okay. CBD is the the cannabinoid that is not associated with any type of high feeling. So there's no euphoric effect associated with CBD. What it does is it helps to control pain and inflammation. It's gonna help for patients that have seizure disorder. It's gonna help with mental illness, and it's gonna help with patients that have addiction. So the last qualifying condition for New York State that actually came on board, it was, I believe, July of 2018, August of 2018, was opioid dependency. So patients who have opioid dependency, we can actually try and wean them off their opioids and put them on cannabis and control their symptoms. This kind of goes through, it's just another slide that talks about THC and CBD. This is a very busy slide, but I put it up there because I think it's important for you to see how there is a rhyme and a reason when I'm having my conversation with you as to what direction I'm going as far as dosing for CBD and THC and where we need to look. So, for example, if we're looking at a patient with fibromyalgia, we're looking at usually higher CBD component with a lower THC. We're trying to bring down inflammation, we're trying to help with pain. But they also could go in the opposite direction, because if there's a lot of muscle spasms associated with that fibro, they actually may do better with something that has a little bit more THC in it, but still a higher CBD component to be able to treat both of the symptoms that they're having, okay? Most patients will start out with what's called a 1-to-1 ratio, which is equal parts of THC with equal parts of CBD. And I'm gonna get into another slide that talks about all the different ways that we can dispense it and how that works. Okay, so we have vapes available, powders, tinctures, capsules, lozenges, oral sprays. About 3 months ago, we ended up getting lotions that you actually can use, topical lotions for certain, if you're just having pain in your shoulder or pain in your knees, you can use that. There is also chewable tablets available now. So why are there so many different ways to take cannabis? Because each one gets into your body in a certain time period and lasts for a certain amount of time. So when I have patients come in for a consultation, it's really important to figure out exactly when is your pain. Is it 24 hours a day? Is it more prevalent in the morning? Is it more in the afternoon? What are we looking for as far as immediate pain relief? Like it may be something for breakthrough pain, or someone who has migraine headaches, where we have to, the minute that migraine comes on, we have to hit it really hard and fast before it turns into a point where they can't go to work, or all they can do is go to sleep in a dark room for 24 to 48 hours. So that's why there's so many different varieties. We have to figure out what's going to work best for them, so as far as their onset and how long we want it to last. Patients can have side effects, and this is one of the things that I always ask patients when they come for their follow-up appointments is, have you had any side effects? So what I'm looking for is any type of dry mouth, which is very common, any type of dizziness, nausea, increased appetite, or mood changes. Now for me, if I have a patient that is going through chemotherapy, or maybe they have a disease that suppresses their appetite and they don't want to eat very often and they're losing weight, decreased nausea and increased appetite to me are not a side effect. They're actually what I'm looking for, and it's a benefit to them, okay? Some of the things you have to watch out for. If patients are diagnosed with diabetes and they're actively on either oral agents or they're taking insulin, I need to make sure that they're monitoring their blood pressure or their blood sugar on a regular basis, especially the first 2 weeks that they start on cannabis. Sometimes what can happen is their blood sugar will spike up initially, and then it will drop down. What I've seen in practice is that over time, patients' blood sugars actually start to decrease because we're working on the insulin resistance through the CB receptors, and they don't need to take as much prescription medication or insulin. It takes time for that to happen, but it's important for them to know that because a lot of times they're stable on a certain dosage, and now we add cannabis on, and they're like, oh my gosh, I get up in the morning, I feel like I'm bottoming out, or my blood sugar feels like it's so low and I don't feel well. Well, we may need to go back to the primary physician or to the endocrinologist and say, you know, these are the readings. I started on cannabis 3 months ago. do I really need to take as much prescription medication? Okay, so that's important. The other thing it can do is it can increase your heart rate initially, and that's when the body's trying to figure out what to do with the THC, when we're feeding that endocannabinoid system. So if patients, the first 2 or 3 or 4 doses, they say, you know, I kind of felt something, you know, like I felt my heart kind of palpitating a little bit. If it lasts the first several doses, usually over the first week of being on it, I'm not very concerned. But if it continues over time, then maybe their body just isn't processing the THC properly at the dosage that I've recommended, and we need to back down on it and then bring them up more gradually. Okay. The other thing that can happen is increased blood pressure. So I do encourage patients that are on blood pressure medication to monitor their blood pressure. And if they don't have a blood pressure cuff at home, I'll go to CVS, go to Wegmans, go wherever they have one, at Walgreens, and just keep track of your blood pressure. Again, in the beginning, as your body's getting used to the THC, your blood pressure may spike up a little bit. And I usually tell them don't be overly concerned about it. Continue to take your cannabis. What you're going to notice over time, and this is just through practice that I've noticed with my patients, is the blood pressure will start to come down. But again, it's important for them to know because maybe they don't need to be on as much blood pressure medication as they were before they started on cannabis. So that, again, it's conversations with cardiologists and primaries, working with them to be able to make sure that the patient's getting the best outcome. There are some drug interactions. We talked about blood sugar and how diabetic patients need to be monitored closely. Again, the other thing is that CBD is a natural anti-inflammatory. So it's going to work along the same lines as an aspirin or a Motrin or an ibuprofen or an Aleve. So usually when patients are taking a blood thinning agent, usually prescribed by their primary or their cardiologist, like Coumadin or Plavix or Xarelto or Pradaxa, those are all things that thin out the blood because we don't want them to clot because they're more susceptible to having a heart attack or a stroke, so we want to thin the blood out. Cannabis, being a natural anti-inflammatory, can also thin the blood out. It doesn't mean that if the patient is on this, that they can't be on cannabis. What it means is that we have to watch them to make sure they're not having like any increased unexplained bruising. Like all of a sudden they're really getting bruised up, they have no idea where it came from. That shows that the blood is starting to thin out. Maybe they don't need as much of this prescription medication. Especially patients that are on Coumadin, they're constantly going for blood tests to monitor how thin their blood is. And what you'll notice is that their dosage of Coumadin over time will actually decrease. They don't need as much of it because they're taking the cannabis. Okay. Whenever you're taking any type of opioid medications, any type of benzodiazepine medications or antidepressants, and alcohol, those are all things that create a sedating effect. They also have an effect on the respiratory system. So I'm always very cautious when I'm putting patients on cannabis that are on those types of medications. That being said, I have been able to help patients decrease their dose of opioids and just control their pain with cannabis. I have also been able to help people wean down on their benzodiazepines. I'm looking at like Klonopin, clonazepam, Xanax. Those are your benzodiazepine medications. So some people might be on the dosing of 1 milligram 3 times a day. I start them on cannabis, and maybe in 2 or 3 months, we can say, why don't we take one of those pills out for the day, and let's drop down to 2, and let's see how you do with it. And while we're doing that, we're increasing the dose of the cannabis or manipulating that dose of cannabis so that we can start to get them down on the lowest dose of their prescription medication that's going to control their symptoms with the use of the cannabis. There are absolute contraindications. So the first one is anyone who is pregnant or breastfeeding. It will, if you're pregnant, it will transfer to the fetus, and it also will transfer through breast milk. Any patient that has some type of psychotic illness, the only psychotic illness that I exclude is schizophrenia, because all of the research that has been done on cannabis in other parts of the world, if a patient has schizophrenia, cannabis will actually exacerbate their symptoms. It'll make them worse. With anxiety, depression, bipolar disease, any other psychiatric illness, I've been more than happy to, register somebody for medical cannabis and work with them with those. Patients that have an active unstable heart disease. So if you have a history of angina or chest pain, and it's controlled with your current medication, you're stable. I will go ahead and certify you for cannabis. If you're somebody whose medication has been changed 3-4 times in the past 2 months, you've been in and out of the hospital in the emergency room for chest pain, you're not stable, we're not putting you on cannabis at that point. Once you get stabilized with cardiology, we'll reapproach, see where they're at, and then we can certify. So it's not like we can never do it, we just have to make sure that your body's ready for it. And people always chuckle with this, they're like, oh, well, an allergy to marijuana or any of its components, the only way you're gonna know that is if you were smoking recreational, so. Okay, legislation, regulation, and distribution. So now we're gonna talk about the New York State Medical Cannabis Program. Okay, so right now there are 33 legal medical marijuana states and DC. There are a few more coming on board over the next few months. And there's 11 of those 33 that actually have legalized recreational marijuana. So New York State legalized cannabis through the Compassionate Care Act in 2014. Under New York State medical marijuana law, let's try that again. Under New York State medical marijuana law, you have to go to a board certified healthcare provider that has been registered through New York State to get a medical marijuana card. So every doctor, every nurse practitioner, every PA out there cannot write for medical cannabis. It has to be someone who's actually gone and taken these state regulated classes to learn about cannabis to be able to prescribe it. There are places that you have to go specifically in New York State to obtain your cannabis. And right now in Western New York, we have 3 dispensaries. So you have to go to a dispensary, you can't pick it up at any regular pharmacy. These are the qualifying conditions we have so far in New York State. Again, I had mentioned that opioid dependency became the last one. We haven't had any in quite a while. There are other states that have a ton more qualifying conditions that patients can use cannabis for. But based on what we talked about so far and the diseases that have been approved, you can kind of see why they decided to pick and choose these certain disease states as to how cannabis actually works in the system with those CB1 and CB2 receptors.
Can you read that list off?
Yes. Okay, so the current list is any type of cancer, any type of neuropathy, whether it be peripheral neuropathy, diabetic neuropathy, a positive diagnosis for HIV or AIDS, epilepsy, which is seizure disorder, PTSD, ALS, inflammatory bowel disease, which again would include irritable bowel and Crohn's disease, Huntington's disease, Parkinson's disease, opioid dependency, multiple sclerosis, chronic pain is usually the most common certifying condition, and any damage to the nervous tissue or the spinal cord, so this could be someone that had like a traumatic brain injury.
Like me?
So there are a ton of potential uses for medical marijuana or medical cannabis, but unfortunately New York State has regulated us to just those. That being said, if I have a patient that comes in and has a qualifying condition in New York State, but they also have anxiety, or they also have insomnia, or they also have something else going on, I don't just focus in on treating them for the New York State qualifying condition. We treat the whole person, we treat all of the different issues they have, and we find a ratio of the cannabis that's going to work for you to treat multiple different symptoms or multiple different chronic diseases. So how do you obtain a medical cannabis card? Again, the most important thing is you have to have a New York State approved qualifying condition. You schedule an appointment with a certified provider. You are going to obtain your New York State medical cannabis certification right here in the office. We're going to print you out directions to register online to verify all of your information through the Department of Health. We do have a lot of patients that come in that have difficulty with computers or they don't have computers at home. So Liz does go through all that, and she will help patients with that in the office, so that when they leave, they actually have a temporary medical marijuana card that they can take right away to the dispensary and pick up their product that we talked about. Okay? You do, as I mentioned, you will get a temporary medical marijuana card that you can print out. But in about 7 to 10 business days, you'll get a permanent card, looks like a driver's license. You need to carry that around with you at all times when you have your cannabis on you. Okay? And again, then you go to the dispensary. This is what a medical marijuana certification looks like. This is what when you come into the office and we do your appointment, you will leave with this. This is good for a whole year. Part of this is a prescription, and it's about halfway down. That prescription is good from the time I see you until the time I see you for follow-up. So usually I'll see the patient for their initial consultation, and then I will see them back 6 weeks later. It takes a little while for the cannabis to get into your system and that endocannabinoid system to be stimulated to be able to see if we're getting a desired effect. So some people see it in effect the first week or two that they're first on it. Other people, it takes up to that 6-week mark to actually see if they're getting any type of relief from what we are initially starting with. That being said, you can go back to the dispensary as many times as you need to during that period of time. So cannabis tends to be a little bit expensive. So what you can do is if you only want to pick up 2 weeks at a time, you can pick up a 2-week supply. You can go back in 2 weeks, you can pick up another 2-week supply. So you can kind of, decide based on your financial situation what's going to work out best for you. Okay. This is what's going to come through the mail. This is what your card's going to look like, but your beautiful face will be on it. Okay. When you come into my office, I actually go on to what's called the New York State Prescription Monitoring Program. So whenever you are on any type of narcotic, which is in New York State, I can actually go onto a website that tracks that. So I'll know what you picked up when you went to the dispensary the last time you were there. So when you come in for your appointment, I'm going to ask you, okay, the last time you were there, we picked up this, and this. How are you taking it? How is it working? What's going on with that? This will also tell me if patients are still getting opioids or benzodiazepines from any other provider, so that we can look at that if that's our goal, is to try and decrease those medications. Okay. Any questions so far? There is some research out there that's starting to come down the pike. I'm not going to get into it in detail. If you want more information, I do have a lot of research articles on our website that you can go through. They're linked according to disease process, so if you're looking for something specific as far as what research has been done, you can click on that and then you can go through and read the actual articles. One of the things that I think is important is that this was one research article that was done about the reduction in the amount of medications that are used through Medicare Part D since cannabis was actually approved and started to be used on a regular basis, that patients are not spending as much money on their prescription coverage, and they're actually able to use, cannabis to control their symptoms. And one of the things they really focused in on was opioid use. This piggybacks on that, talks about how there's fewer pills being prescribed in medical marijuana states. This again talks a little bit about opioid death and the decrease with the use of cannabis. This I found very interesting. I went to a medical marijuana conference about 1.5 years ago, and there was a doctor that was talking about seizures or epilepsy. And he put this slide up, and I had asked if I could, use it in a presentation. He said, absolutely. Cannabis, we know, has been around for thousands of years. It was actually the first medication that was used for seizure control. These are all the dates and all the different seizure medications that we've gone through and used. And here we are, 2019. What's the top thing we're using for seizure control? CBD, cannabidiol. So it just tells you the difference between using something natural and using something that is synthetic and being manufactured by Big Pharma. Okay, so where are we today? This is important because this talks a little bit about how the research is being done. And of course, whenever you're looking at things from a financial perspective, whether it be an herb or whether it be a medication, this talks about the different types of FDA-approved prescription drugs. Now, the FDA wants to approve something that's been synthetically modified. So far, there are actually 2 on the market that have been used, and there was a 3rd one that came out not too long ago about just CBD itself that they wanted to use with patients that had seizure disorder or had MS or some type of adjunct therapy for that. When you come into the office, I always have patients watch 2 videos that I absolutely love because it talks about the endocannabinoid system and it talks about marijuana. And they were both put on by this physician, Dustin Sulak. And he talks a lot about the importance of using the herb and to not give up when you first start on it because you may not feel an effect. It may just take time for you to build up those receptors in your endocannabinoid system for it to work properly for you. That being said, one of the things that I've noticed, and it's like the trend, that when patients start off on cannabis, they're usually taking a lot more because they need to feed their endocannabinoid system to get it working properly and to control their symptoms. But between 7 months and 9 months of being on the product, I noticed that most patients do not need to take as much of the product to be able to control their symptoms. They're usually taking much less of it. And some of them aren't even taking it daily. They may be taking it 3 or 4 times a day the first 2, 3, 4 months. Then they'll start to wean down a little bit and say, I noticed I didn't need to use it as much, or I don't feel like I need as high of a dosage, so I've cut down a little bit. But guess what? My symptoms are still controlled. Well, it seems like when you get to that 7 to 9 mark, that's like the sweet spot where you know exactly how much you really need to control your symptoms. And 9 times out of 10, it is so much less than when you started. So also from a financial perspective, when people say, I can't afford it, it's so expensive, I tell them there's light at the end of the tunnel. You may need to put up a little bit more in the front, but you're going to get much more of a benefit on the back end. And that's the end.
That's my favorite picture.
Thank you.
This is, ladies, I have one story. This is when you know you're old. Dated this guy like 20 years ago. One night we rent Cheech and Chong. Well, we're watching it and we're laughing, and the one part where he takes all the acid, I look at Rob, I go, he could die. And he goes, Paula, it's a movie. I'm like, I'm too old.
But I always put this slide up here because this is really what people think. They think, oh, we're going to get our ganja out and we're just going to puff away in this big van and there's going to be this big puff of smoke. And it's so not like that at all.
What is the cost about?
Well, the cost depends, number one, on how you're taking it. If your vapes are going to be a little bit differently priced than capsules. Vapes get into your system in about 15 to 20 minutes, but when you use it, it only sticks around in your body for about like 2 hours. So if you're somebody that knows that a migraine is starting to come on, or they have that sensation that that's going to happen, I recommend that they always have a vape, because if you already feel that you're going to be getting a migraine, if you take 2 or 3 hits of your vape, it's going to stop it in its tracks and you're going to be able to move on with your day. It's going to prevent you from having to go and isolate yourself and not be able to function. So the price of that is different than if you're taking a capsule, where a capsule gets into your body in about an hour, but it sticks around anywhere from 8 to 12 hours. So that's going to be priced differently, because now you're looking at something that has like an extended release on it. So it's really depends on the mechanism of action and how long it's going to take.
What about like the tinctures?
The tinctures, they get into your system in about 30 minutes, and they usually last anywhere from 4 to 6 hours.
Okay.
So I like to use tinctures a lot for bedtime use. I also like to use vapes for bedtime use. But it depends. I have some patients that come in and say, I can get to sleep, but I can't stay asleep. Well, if you can get to sleep, great. To stay asleep, I would use a tincture, because you know you're going to get at least 4 to 6 hours out of that tincture. Most people, once they're comfortable, they will sleep the 6 hours, but they're not gonna wake up groggy in the morning, cause it's gonna wear off before the, at the time that they wake up. Versus putting someone on a capsule that's gonna have anywhere from 8 to 12 hours, and they may wake up and feel like they can't function to go to work in the morning.
So basically, it just depends on what you're treating the person for.
What you're treating, and there's some patients that I use tinctures with, and they really like the tinctures, but if you're trying to treat something that is present for 24 hours, you have to take that tincture 3 to 4 times a day to get effective relief. And some patients are fine with that because they can control the dosing. I can take a half a milliliter on days that I feel pretty good, and then on days that I don't, I can take a full milliliter. And they like the fact that they can dose that way. But then I have other patients that are going all day long, and they're like, well, I always forget to take it, and then it's too late because, now I'm already having an issue, and they like the capsules. So it's nice that we have a lot of, flexibility.
What would the lotion be for?
The lotion would be used, I would say, more for like
pain, spot pain?
spot pain, localized pain, osteoarthritic pain, rheumatoid pain, especially if it's, joint oriented.
Okay. Well, good information.
Are there any conversations about, ultimately about insurance coverage, like we have for other prescriptions?
I do not see the insurances
haven't heard.
picking it up until the federal government actually says that it's
That's
federally
good.
legal.
Yeah, oh, yeah.
And
That's
until,
one small problem.
that's a huge problem. And I keep looking to see where we are as far as legislation, and, they're dragging their feet.
Yeah.
They're really dragging their feet, and I really don't understand why, because,
Yeah.
It's
we're
money.
controlling it on
Big
such a,
pharma
I
that
know.
makes too much money.
You're absolutely right.
And they
That's what
pay
it
too many
is.
people out.
That's what
Yep.
it is.
Absolutely.
Yep. Because it's helping so many people.
They're waiting to let Big Pharma get all lined up, because they're lining up right now,
Exactly.
then they'll take the whole thing over, and then it'll be covered. I just
Yep.
read about that,
And that's why, like, we have the 2 drugs, and now they're gonna wanna have
Yeah.
more, and.
yeah.
And the other thing we do have, everybody asks me, well, when is it gonna go recreational? When is it gonna go recreational? I honestly don't know. I've heard rumors that it was gonna go recreational this year. I heard rumors that it might be next year. But one of the important things is that we need to make sure that the medical portion does not get thrown by the wayside, because that's happened in other states. And what's happening is, depending on how the state is regulated, if you have a certain amount of patients that are medical marijuana card holders, and they have chronic conditions, they need to have first-line access to that medication versus someone who's gonna buy it off the street for recreational use. And what has happened is when recreation takes over, there's been a decrease in production, and the medical patients are having a hard time getting what they need. So some of the states are implementing things properly the way they should, where, you have to have a certain amount designated for all of your state certified patients, and then you have your excess. The other thing I see happening too is, and I'm hoping that this is how it comes down when it comes to legislation, is that medical patients are gonna have access to higher THC levels and higher CBD levels, as far as being able to purchase products with that versus recreational. I can't remember what state it was, but they had said that actually they thought that they were afraid that their medical portion of their cannabis program was really gonna go downhill. And what they noticed was that because the state had decided that they had to have so much on hand for those medical patients, they were running out of recreational, and patients were wanting to become certified for medical so they could actually gain access to it.
So definitely a lot of information pertaining to this.
Yep. It's kind of like a science. Sometimes with, trying to figure out what THC to CBD ratio, you kind of feel like a mad chemist trying to figure out exactly what's going to work for each person, because it is so individualized. The other thing that's important, and I tell patients this too when they come in for appointments, is that usually I'll make a recommendation to send you to a certain dispensary to start off. And each dispensary carries the same ratios of cannabis. So you can get what's called like a 20-to-1 ratio, which is higher in THC than CBD. You can get a 1-to-1 ratio, or you can get what's called a 1-to-20, which means you're higher in CBD. And then there's a few in between. But what's important is that if you go to one dispensary and you get a 1-to-1 ratio, you're not necessarily getting the same ratio or the same amount of milligrams as you are in another dispensary.
Really?
So you can go to one dispensary and you're gonna get 5 milligrams of THC with 5 milligrams of CBD. You can go to another dispensary and you're gonna get 2.5 milligrams of THC to 2.5 milligrams of CBD. And you're not linked into having to go to a certain dispensary. So I have a lot of patients that like to price shop. And one dispensary is definitely lower priced than the other dispensary. But what patients don't realize is you're gonna get half the dose at this dispensary than you were getting at this dispensary. And you may have started off here, but thought, oh, the prices are so much better over at the other one, I'm gonna go there. And they think that their symptoms have actually gotten worse. And it's not that their symptoms have gotten worse, they're not taking enough of it to control their symptoms like they were previously.
And where, I know you mentioned this once before, where are the 3 dispensaries?
There is Vera Life, which is located in North Amherst. There is MedMen, which is right over here on the corner of Main and Transit. And there is one down on Seneca Street by the Larkin Center called The Botanist.
I heard good things about that place.
Yes.
Is that where you would probably send a lot of people?
It depends on what I'm looking for as far as
Okay.
dosage. It really depends on what you're trying to treat. Now, there's, some patients that I can have them do a 1-to-1 ratio of 2.5 milligrams to 2.5 milligrams. But if I have somebody that's been on opioids for a long period of time, or they've been on benzos for a long period of time, and I'm trying to help them with PTSD-like symptoms, or I'm trying to help them with chronic pain, and they've been taking these high-dose prescription medications for such a long period of time, I know that 2.5 milligrams is gonna do nothing. I have to send them where I can get the dosage that they need. And then I have other patients that have problems with absorption. So they can take in a capsule, but they're not absorbing it properly. So they would do much better with a tincture, which they all carry, or if they have a hard time taking the tincture, because sometimes their flavor is not palatable to certain patients, I can send them to the botanist, and they have a powder formulation, and they're the only ones that has powder.
Oh,
So that would guide me to send them over there versus going somewhere else.
Mm-hmm.
That's where Dave has gone, to the botanist.
Mm-hmm.
Yeah, they're really nice in there, the one guy that worked with him.
Mm-hmm.
Yeah, that's what I heard.
Yeah.
I heard
And
they're really
he's
nice
got,
there.
I don't know if you know him, his name is Matt, I think, or.
Dan is the
It's
lead
Dan,
pharmacist there.
and his children have seizures, right, or something. He's a big story about how he got
Yes.
into the whole industry. He's a nice man.
Very nice, yes.
Yeah.
Yep.
And,
I do
very
know him.
patient.
Mm-hmm. Yes, he likes to educate.
Yeah,
He really likes to make
yes.
sure when people leave, they know exactly what they have and what the response should be.
Yeah.
So,
So the tinctures could be different prices at all 3 places?
correct,
Really?
yes. And they can because the dosage is different.
And they all have different sales at different times too.
I'm glad you pointed that out because that was the
Really?
other thing I was gonna say.
What?
They
Different
have
what?
sales?
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 You're
Yes,
kidding.
no.
Really?
Oh, yeah.
Sales.
They have, the reason being, they have to put an expiration date on the product. So when it gets close to the expiration date of that product, within a month or two, they have to sell it off. But they will guarantee their product for up to a year after the expiration date that's on there. So you may be on, I don't know, let's just say blue capsules from PharmaCannabis, which are high in THC. And maybe, and I don't know exactly what the price is right now, but maybe they're going for 125 milligrams for 60 capsules. And all of a sudden it's getting to the end, where their stock is gonna expire and they have to get rid of it. So you might be able to get that $125 bottle for $40 or $30 at one time. Yes. So then people wanna stock up, cause they'll be like, well, it's good for a year.
Can you
Wow.
stack up?
Yeah,
Yes.
you're allowed a certain amount.
Oh, yeah.
Yeah, according to New York State, but yes, you can.
But
Yeah.
otherwise, are the prices the same for the same dose? Or do they charge different price? Like if it's 2.5, it's this price?
Is that the same price at
Yeah,
all
is that
of
the
them?
same price at all 3, their regular price?
Well, that's the thing, they don't all carry the same
Oh.
milligrams.
Okay.
So for example, if you go to Vera Life and I say get a 1-to-1 ratio, they're gonna give you 5 milligrams and 5 milligrams. And if I send you down to MedMen, they're gonna give you 2.5 to 2.5. So,
And it might not necessarily be half as much. I mean,
It's
half the price.
half the price, right? So you would think, okay, well then I'll just take two, well, you end up spending more that way.
I got you, okay.
But you know that, like you know that it's 2.5 instead of 5?
I do,
I do would know that,
yeah. And they should tell you.
yeah.
But they don't, because it's just a lesson learned the hard way, where you put your money.
Mhm.
And they I've gone to Verilife, which used to be Pharmacanis, and they also have, I get a military discount, I get a disability discount. I think now I get a baby discount.
Oh, so if you're a senior, so you get a senior
How old is
discount?
that? What is that, what is that age?
I don't know if
Oh.
it's 50 or 55.
Oh, that's okay.
That's all right. Wow,
Yep.
senior discount, I like that.
Yeah, but they all have different ones.
Wow.
So I always tell people, make sure you get their emails, cause they'll send emails to let you know when they're having their sales,
Okay.
and then go stock up. And, you tell them all about, see what kind of discounts they have. And I do know that the botanist works with a lot of people financially as to, where their income level is and what they can do to help them out with pricing too.
Yeah.
I mean, they all kind of do, but I know that the botanist really works with a lot.
There's
Yeah, I
that
did
in
hear
here.
good things about the botanist.
The botanist also gives a discount for our patients too.
Oh.
They see that Sherry's the
Yeah, good to know.
practitioner, so he gives a discount
Sherry's
for
a
ours.
catch me
So I know you can't answer this, obviously, but, like, what is it, like, approximate cost? I just like, to move forward, I would need to kinda know.
Let me pull a price list.
Like,
I got the
Do you have the
leaflet.
leaflet?
Yeah, it's up right up there.
Okay.
just curious, so,
So there's a website called leafly.com, and if you go on there, you can actually look at the products that are available at the dispensaries, if they have them in stock, because they do run out, and what their prices are.
So the 20 to 1 tincture is 65 for 285 milligrams.
and how
Tablets
long
are
does it
50.
last, like? Oh, well, that would depend, right?
Yeah, that all depends.
Depends on, okay.
Can you get at least a month out of it, or not really?
Well, you figure you have a 30 milliliter bottle, no matter where you go, you're gonna get a 30 milliliter bottle. So
Okay.
if you only need to take a half of a dropper at night to help you sleep, then it's gonna last you 2 months. If you have to take a full dropper, it's gonna last you 30 days.
Gotcha.
If somebody needs two full milliliters,
I was
which they
just
do.
curious, like,
Do
okay,
Yeah,
like,
just
is it
those
thousands
prices
per
are not
week?
bad, because
Yeah.
I've gone to Feel Right and gotten the Charlotte's Web. It's $120. Or I don't even know what it.
The milligrams or anything, how much
the
you're getting.
milligrams or how, I don't know,
Right,
how big the bottle was really. And that, to look at these prices, they're not bad.
and then a lot of times, what you'll
Well,
notice,
depends how long they're good for, I suppose.
the other thing you'll notice with over-the-counter products is they always tell you how many milligrams is in the entire bottle.
Yeah,
Okay, so you have to pay attention to how much is actually in the dose that you're gonna take. Okay?
it always says a dropper full.
Right, but I usually on the bottom of the bottle, it might say 950 milligrams of CBD, and you're thinking, 950 milligrams of CBD, that's
Oh,
great.
right.
That's in the entire bottle. You need to figure out the math and figure out, well, how much am I actually getting every time I take it?
Yeah, you're right.
I'm too afraid to try any.
Well, that's why
Don't
you
be
come to me.
Yeah,
Yeah,
that's right, that's why I'm here.
Yeah, don't be
Because I'm like,
afraid.
yeah, I'm not gonna really, go be buying CBD at the video store,
Oh, gosh, no.
or the gas station, cause they have it everywhere.
They do have it everywhere. And the other,
Is this correct? Sorry.
and I agree with you, you don't know what you're getting, you really don't. And it's hit or miss if it's gonna work for you or not.
You don't know how to dose it yourself.
No, there's no way.
So one of the things that's a little bit different about what I do versus a lot of other medical marijuana certifiers. There are a lot of certifiers out there that will,
Thank
and
you.
this is a lot of the stuff that people are seeing online, because you can go online, you can talk to a doctor, you can Skype with a doctor that you've never met, they know nothing about you. They talk to you for 5 minutes and they certify you through New York State, and they say, okay, great, have a good time, and good luck, I'll see you in a year when you need to be recertified, and they kind of leave you out there hanging on your own. And you go into the dispensary, and you talk to the pharmacist, but, you know, the pharmacist knows a little bit about you, but doesn't really establish that rapport with you to know exactly what we're trying to treat. So that's what's a little bit different when you come here, is that I see you in 6 weeks. I talk to you the first appointment for close to an hour by the time we're completed, so we know what direction we're headed in. I see you at the 6-week mark, we make some tweaks, and then I see you every 3 months. And the reason I do that, number one, is because it's proper medical care. You should be monitored from, you know, you shouldn't just be left out there and, you know,
Oh, yeah, absolutely.
on your own trying to figure it out and not getting any, and what happens is people don't get results, and then they say, oh, that program doesn't work. Well, it does, but you have to have the guidance to get through it. The other thing is that we live in Buffalo. The seasons change, there's 4 seasons. You could be somebody who does really great in the summertime, doesn't need a lot of the product, uses it whenever they need to, and October comes and it starts to get cold and they start to feel achy and things are changing and their sleep pattern is changing. And they need adjustments. So we need to monitor that and see, where are you now? Do we need to increase the dose? Do we need to change it from a liquid to a capsule? What's gonna work better for you now? And then maybe when, you know, the next season comes, things are different. The body is always changing, and we need to just adapt the cannabis to treat what's currently happening.
It's a lot of trial and error for probably the first 6 months to a year, but when you get it all under control, it's heaven on earth.
Makes a difference, for sure. Oh, that's exciting, it's very uplifting, positive, exciting information, absolutely. And yeah, we are all different, our bodies are all different. And I know what you just said, I feel better when the weather's nicer than I do now.
And especially if we're treating some type of, you know, psychological illness or anxiety or depression or things like that. There's certain times where people have more anxiety, especially if it's situational, like around a holiday, or is it around a death or a birth, or, you know, there's all different things that come into play when it comes to that. And you have to be able to have that conversation with your provider to figure out, you know, I'm not feeling well, I'm doing what I've been doing, but now this has happened, how do I adjust that, what do I do with it to make, you know, to control my symptoms and help me get the best outcome.
And sometimes if you are feeling anxious or overwhelmed or whatever, the pain is worse. It affects the pain. So it's a whole connection of things that trigger things.
It's a whole mind-body connection.
It is, I totally, what you say totally makes sense. I'm excited.
I put some pamphlets on your chairs, and I put this on there because I have patients that are kind of leery about purchasing oral agents, and because there's THC in it, plus taking pills and then adding something on top of that, like a topical product. Because again, you're still getting THC. My example to that is that I had the pharmacist actually from the botanist came in and he said that he had someone come in and they had overall joint pain all over their body, rheumatoid arthritis. So they just lathered it on. Well, they had taken in so much THC that they slept for like a day because they had OD'd on the THC. Now you wouldn't think of that because it's topical. But if you're putting a small amount on one area, that's one thing. But if you're starting to put a small amount on one area, but you're also taking capsules and you're taking a vape and you're using something at night, the THC is mounting. You're taking more and more and more. That you don't want to add on another thing. So these are products that we actually carry in the office. One is called Momed. This I like because it's a combination of not just the CBD. It also has arnica in it, which is a homeopathic that's used for bruising and pain. It has MSM, which helps with inflammation. It has some lidocaine. And I've had very good results with this. And a little bit goes a long way. So when I say a little bit, you're looking at like the size of my pinky nail. It's what you put on like your entire neck. You know, just lather it on.
Good.
This is another product that they make that I've used for a lot of patients that have, or another product that we carry here for neuropathy. So if you, say you have neck pain and it goes into, you have pain that travels down your arms, or numbness or tingling in your hands, or you're a diabetic and you have it in your feet. This is something that you can also use that has CBD in it, but it has other components to it too that are all good for that, like daisy and capsaicin, which is cayenne, and geranium oil. So it's a combination of a lot of different things. So I just wanted to make you aware that there are products like that out there that do not have THC in them. And they work, so it's not like you're
What's
gonna.
the price for those?
You know what, I can ask Liz exactly what they are. There's different sizes that we carry and they're all
Okay.
different prices.
You carry these in here?
We carry them here, yep.
My husband, I think it's random drug testing. So how would this affect, if he did this?
Oh, there's nothing in there, there's no THC in there at all.
THC.
It would not affect him at all,
But if he did, if he saw you, it would, probably, right?
yes.
Like, now, would that be excused if he needed to have that?
Okay, I always ask people,
Just curious.
where do you work, what's your HR policy? Usually, if it's considered a federal, like, company, or it crosses state lines, because every state has their own, policy regarding cannabis, they usually, if you get randomized drug tests, you come back positive, it's gonna be a problem.
Yeah, okay, I just wondered.
But if it's, if it's a local company and you're in New York State and it's approved in New York State, I always tell people to check with your HR, see what their policy is, because a lot of them have now incorporated that as if you were on any type of prescription medication.
Right.
So you tell them in the beginning, when you do your randomized drug test, I'm on medical cannabis, here's my card, I'm gonna come up positive for THC, and they basically write it off as being a clean urine,
Okay.
because you're taking the product and we're seeing it. That's the other thing I do in the office too, and it's kind of funny, because most people are like, oh my gosh, you're gonna drug test me? I do a drug test at 6 weeks, and I'm looking for THC.
Okay.
That tells me that you're taking the product and you're not distributing it to other people. So
That's very good.
so I do testing at six weeks. I can do random testing throughout the year if I need to. For most people, I don't, but I always do it once a year, because your certification's good for a year, so when you recertify, you do a drug test.
Okay.
And I wanna see THC, so.
And does it help like with the hormones and stuff too? Cause I saw that something popped up about the hormones.
I would say it can help the hormones, but I would not directly say, I have a hormone imbalance, I have something that's going on, cannabis is gonna be my lead.
Okay,
I would be doing other things before I would be looking for cannabis to control that.
okay.
Well, thanks everybody for coming out.
Yeah, thank you. Awesome
Thank you.
presentation.
Oh, you're welcome.